Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
I think that's a common problem we are facing with many patients and many diseases, is that patients need to understand we're not fixing the condition. We're helping to treat it, but it's a chronic disease and you're going to require this medication.
Right. The medication, the aim of the medication is to ease your symptoms. Medically, we can certainly fix your problem, but we'll speak about that a little later when we get to the surgical options.
Good. So now you mentioned that you could be on these medications for a prolonged period, sometimes maybe indefinitely or lifelong. So that leads us to the next question, or the obvious question. When anybody's going to take medications for a protracted period of time, they're going to say, Doc, what are the side effects? What are the problems I need to be worried about?
Right. Very, very valid question. The side effects, of course, will vary from person to person. Some of the common side effects of medication that you will take for your prostate include dizziness, because sometimes it can drop your blood pressure a bit, and for that reason we encourage our patients to take a certain class of these drugs in the night when they're lying down. So usually they adjust very readily to this dizziness and it doesn't last for more than a few weeks. Some persons tolerate it less than others, and for those persons there are some other options in terms of medication that we can use with less side effects. Other than that, there's usual tiredness. They can experience a stuffy nose or nasal congestion. A certain class of drugs may in fact affect your libido, which is your sex drive, and can in fact affect your sexual function, mainly your erections. If you find that this is happening, have a conversation with your doctor and there might be alternatives for you.
Okay. Now you mentioned that one of the side effects is lowering your blood pressure, and high blood pressure is now epidemic in the world and epidemic in Guyana. So let's deal with the male who has BPH and also has high blood pressure. Any unique strategies towards that? I mean, because they're going to wonder, should I still continue to take my blood pressure medicines, or what is your response to that?
Right. So that's where history taking becomes incredibly important, because it's very important for the doctor to know that the patient is hypertensive and may be on medication. Knowing that a possible side effect of this drug is the lowering of your blood pressure, you need to use the drug judiciously, usually started at a very low dose, and the patient is monitored very closely to see their response. So they should not stop taking their hypertensive meds that they've been prescribed earlier, but you can work with your urologist and your internist in tailoring the drugs that best suits each patient.
So we reviewed what is benign prostatic hypertrophy. We reviewed where is the prostate, how you check the severity, medications. Now, not everybody is going to succeed on medications, or not everyone may want to take medications forever. So you did mention surgical options. So what are the surgical options, and when are they indicated? Sorry.
Right. So like I mentioned, surgery becomes into play under certain circumstances. Some patients, some men are not good candidates for medication, even from the beginning, even from the first visit. And these are men with very large prostates that are severely symptomatic. These are men that have complications of BPH, like we mentioned, urinary retention, recurrent infections. Those men almost immediately are offered surgery because they meet the criteria for surgery. A lot of men also will fail, quite frankly, their medical treatment and go on to progressively worsen their BPH, and those men will then become candidates for surgery as well.
Okay. And
sorry, I'll interrupt just to say that, like you mentioned, some men make the conscious decision of not wanting to be on medication for a prolonged period of time and will opt for the surgical option.
Good. So let's talk about the different surgical options and when you may select one over the other, or recommend one over the other.
Sure. Without becoming or getting too technical, there are mainly two surgical options that I'll probably mention. The first is minimally invasive, and this is done by inserting an instrument through the penis, which allows us to access the prostate gland. That's something called a TURP. is the most popular name for it, and it's an incredibly common procedure for prostate, benign prostate disease. The aim of that procedure is to shave the prostate gland, the enlarged gland, away. It does not completely remove the gland, but it shaves it with the main aim being to open up that urinary passage and make it easier for the man to pass urine. The gland is not completely removed, and so it can actually continue to grow even after the procedure, and it can become bothersome later, maybe a few years after. The other procedure that we use when treating the prostate surgically is an open prostatectomy, and this is done by an incision, a skin incision in the lower abdomen. The entire prostate is removed in that process, and this is usually a procedure done for very large glands, and men with bladder stones or bladder issues as well.
Okay. Now let's go back to the minimally invasive procedure. This is the one where you pass an instrument through the penis to shave the channel. Does that require general anesthesia, or are there options?
There are definitely options. It can be done under spinal anesthesia, so the patient can be awake, but not, of course, not experiencing any pains or discomforts. And again, it's on a patient-to-patient basis, and this is a discussion that you will have with the urologist as well as the anesthetist, and they will come up with what's safest and best for you.
Now, I know every time we're talking about managing conditions of the prostate and dealing with men and concerns about libido and sexual function, the complications of surgery for BPH.
So every surgery has some degree of complications. Let's speak a little bit more of the long-term complications. The long-term complication, one of the immediate thing that you need to discuss with your patient is they will experience something called retrograde ejaculation. So instead of the semen coming out of the penis after an orgasm, the semen will actually go back into the bladder. This is not at all dangerous, but what it does mean is the man will not be able to father children. Okay. Outside of that complication, which of course is a given, the other complications would be, well, one of the most common questions I get is, will this affect my sex life? Will this affect my erections? The answer to that is not very simple. Any kind of pelvic surgery can potentially affect your erections. As it relates to TURP and prostate surgery, we've had reasonably good results with that. Some men are affected, but this effect is shown to be more or less transient, and they usually get back to their pre-surgery erectile function. Okay. If not immediately after surgery, after a few months.
Now, so we've talked about medications and we've talked about surgery. But what about those patients, or are there lifestyle changes that we can have the patients make before we try those two options?
Oh, absolutely, especially those that have mild symptoms or mild BPH. Lifestyle changes are, kind of the cornerstone of what we would recommend. And even, of course, you're on medication and have moderate symptoms. These lifestyle changes that I will mention to you can be helpful. They include avoiding certain things that might make your BPH or your urinary symptoms worse. And those could be things like antihistamines and other drugs that you will use for cough and colds. Alcohol and caffeine will, in fact, worsen your symptoms, and so, you should be used in absolute moderation. One of the important things you can do, especially if you've been experiencing frequency and getting up a lot at night, is reduce your intake before bed.
That's your intake of fluids?
Of fluids, absolutely.
Okay.
So those are a couple of the cornerstone lifestyle modifications that you can use.
We live in a world and in a country where there's always a discussion about non-traditional medical options, whether they be herbal or whatever other terms we want to use. But what about those therapies? Is there a role for some of these other therapies like saw palmetto, etc.?
Saw palmetto. I hear about that very commonly, very frequently from my patients. They bring a bottle in and it's marked some kind of prostate drug, and the active ingredient usually is saw palmetto. Okay. There are a few institutions that will actually recommend saw palmetto around the world, and I of course have very many patients that sometimes say, well, not that many, but a few patients that say that they experience some relief by using this drug. There are lots of studies done to show why this drug potentially has an effect on improving your urinary symptoms, but those studies are not very strong conclusively. The evidence behind using soft memento is not very strong, and I actually don't recommend it to my patients.
Okay. So medications, lifestyle changes, and surgical options.
Absolutely.
All right. At this stage, we're going to ask Dr. Chris Prashad to summarize what are some of the key points he wants our viewers and listeners to take home from this talk on benign prostatic hypertrophy. Dr. Prashad.
Sure, happy to. So we mentioned that the prostate gland is a gland found only in males and that it can become enlarged. This is called BPH, or an enlarged prostate. BPH can affect the man in many different ways. Firstly, and let's get this out of the way, it has nothing to do with cancer, nor does it increase your risk of any kind of cancer, okay, especially not prostate cancer. It can affect the man, usually his urinary stream, and it can present with things such as a decreased stream or flow, urgency, needing to go to the bathroom very quickly and urgently, needing to wait a while before the urine comes out, experiencing the feeling that you haven't quite emptied your bladder properly, or dribbling towards the end. Those are some of the most frequent symptoms of prostate enlargement. Should you experience those symptoms, of course, the first thing you need to do is to see your doctor, see your urologist, because there are many different options available in terms of treatment. It can range from watchful waiting, which is just observation, or it can move on to medication or even surgery.
Dr. Prashad, you see the questions here, and a program dealing predominantly with a disease that affects men. And obviously one of the first questions when we talk about prostate diseases, persons are going to worry, how is this condition going to affect sexual function? So specifically the question here is, can benign prostatic hypertrophy affect male sexual function? And then again, about erectile dysfunction. So let's break it up a bit. Let's talk about benign prostatic hypertrophy and sexual function in general.
Okay, thanks to your viewers for submitting the questions. Firstly, generally speaking, any disease process that affects the pelvis can affect the person's sexual function. And you mentioned there might be two things to consider. One is their libido, which is their sexual drive, and the other has to do with their erections. BPH can, whether directly or indirectly, affect some of those elements. BPH can be a significant bother for some men, and therefore they have very poor urinary stream, they struggle to pass urine, they have recurrent infections, they have pains, and all of those things combined can affect their libido as well as their actual erections. Okay. So indirectly or sometimes directly, it can affect your sexuality.
So the answer to the question would be yes, and you really need to get it. Now, the next question has about the screening exam, and you and I both know that this is, we would have to say, the biggest obstacle to getting men in to see their doctors. Talk again, for those who may not have heard or are not aware, what does the screening, and what people are talking about is the digital rectal exam, and how is it done, and the discomfort that may or may not be experienced.
Okay, so when we speak about screening for BPH, we're talking more about the diagnosis of BPH. And diagnosis, I'll recap, starts with a history, a thorough history, so questions are asked and the responses are noted. And I think what most persons are curious about is the examination. The prostate is located very low down in the pelvis, and it's very closely related to the rectum. As a result, when we need to examine the prostate, we need to examine it through the rectum. We do this with a gloved finger that's lubricated. The patient is usually bent over a couch or is on a couch with their knees folded. And very gently, a finger is inserted into the anus to be able to feel the prostate. This is not usually painful. And in fact, if the patient does have a lot of pain or discomfort with it, it can prompt the doctor to think that there may be other aspects that they need to investigate. So in terms of your viewer's question of whether it's painful, the answer is generally no. And it should not be a great discouragement for someone.